Hello, good morning everyone. So this is our fourth week. So our topic this morning is all about basic first aid in PE. But before that, this is our objectives. A. Define what is first aid. B. Show importance of first aid in injuries. C. Develop in applying appropriate first aid techniques to specific injuries that may occur in sports. Basic first aid. First aid is an immediate and temporary care given to a person who has been injured or suddenly taken ill. It includes self-help and home care if medical assistance is not available or delayed. There are common injuries encountered by officiating officials and athletes. Number 1 is sprain. Sprain is caused by torn fibers in a ligament. Swelling and bruising are some signs and symptoms. Number 2 is heat exhaustion. Heat exhaustion is a response to heat characterized by fatigue, weakness, and collapse due to inadequate intake of water to compensate for loss of fluids during sweating. Heat exhaustion sprains. Remove any clothing or jewelry around the joint. Apply cold compress at once. Elevate the affected joint. The victim's physician may recommend an over-the-counter anti-inflammatory medication, aspirin or ibuprofen, appropriate for the victim's general health. Have the victim lie down with his or her feet elevated. Keep the victim cool. Give him her electrolyte beverage to sip or make salt drink. Monitor the victims for signs of shock. If the victim starts having seizures, protect him or her from injury and give first aid for convulsions. If the victim loses consciousness, give first aid for unconsciousness. Other serious injuries that required immediate care or first aid include sprain versus strains. Sprains is a stretch or tear of a ligament, that band of connective tissues that joins the end of the bone with another. Sprains are caused by trauma such as a fall or a blow to the body that knocks a joint out of position and in the worst case, ruptures the supporting ligaments. Sprains can range from first degree or minor to third degree, the worst. Areas of the body most vulnerable to sprains are ankles, knees, and wrists. Signs of a sprain include varying degrees of tenderness or pain, bruising, inflammation, swelling, inability to move a limb or joint looseness, laxity, or instability. Strain is a twist, pull or tear of a muscle or tendon, a cord of tissue connection, muscles to bone. It is an acute, non-contact injury that results from overstretching or overcontraction. Symptoms of a strain include pain, muscles spasm, and loss of strength. Whilst it's hard to tell the difference between mild and moderate strains. Severe strains not treated professionally can cause damage and loss of functions. Knee injuries. Because of its complex structure and weight-bearing capacity, the knee is the most commonly injured joint. Each year, more than 5.5 million people visit orthopedic surgeons for knee problems. Knee injuries can range from mild to severe. Less severe would be tendinitis, patella femoral compression syndrome, or iliotibial band syndrome, and bursitis. To name a few, more severe injuries include bone bruises or damage to the cartilage or ligaments. Major injuries are common to the anterior cruciate ligament or ACL, meniscus injuries or posterior cruciate cruciate ligament or PCL, medial collateral ligament or MCL, and the lateral collateral ligament or LCL. Knee injuries can result from a blow or twist to the knee, from improper landing after a jump, or from running too hard, too much, or without proper warm-up. So, other common sports injuries suffered by athletes are shin splints, Achilles tendons injuries, patella dislocation, and hamstring, quadriceps, and calf injuries. So this is the examples of the common sports injuries. Dislocations. When the two bones that come together to form a joint become separated, the joint is described as being dislocated. Contact sports such as football, basketball, and lacrosse, as well as high-impact sports that can result in excessive stretching or falling, cause the majority of dislocations. A dislocated joint is an emergency situation that requires medical treatment. Home treatment for sprains and strains. Minor sprains and strains can be treated at home using the following measures. Start treatment as soon as possible to reduce swelling and speed up recovery. The less swelling, the more blood can get to the injured part to start the repair process. Apply the RICE method or RICE. Do not apply heat during the first 2 days as this will only increase swelling. Use paracetamol for the first day of the injury to reduce pain without increasing bleeding. Thereafter, ibuprofen or other non-steroidal anti-inflammatories or aspirin is a good choice. Don't give aspirin to a child younger than 16 years. Apply arnica oil to reduce swelling. Remove rings immediately if the injury is the hard of fingers. After 48 hours, start moving the limb gently, but only enough not to cause pain. Gradually increase the range of movement. Let pain be your guide. Strains usually heal in about a week. Sprains may take up to 3 weeks to heal. For fractures, apply the RICS method. Keep the limb in the position you found it and place soft padding around the broken bones. Splint the injury with something rigid, such as rolled up newspaper or magazines, to prevent the bones from shifting. Don't move the broken bones. Splints must be long enough to extend beyond joints above and below the fracture. If there is an open fracture, cover it with a clean gauze pad. Apply pressure to control bleeding. Don't try to push the bone back into the wound and won't attempt to clean it. Get medical attention immediately. Fractures of the femur and pelvis may cause severe internal bleeding. Don't give the person anything to eat or drink in case surgery is needed. Human basketball. You will be playing a game. It is dubbed as human basketball. It is different from the regular basketball that you know. Supposing there are 8 players in your team playing on court. Others who will not play will stay at the area designated to your group or bench in this case. While waiting for the substitution, 4 members will be playing. One will serve as the basket for your opponents to shoot the ball. The final 3 will serve as guards to stay around the human basket, with which your team will shoot and earn points. To move the ball from one player to another. Past it, your team is allowed to dribble the ball 3 times only. So roles of the game, number of players per team 8. Objectives of the game, to shoot the ball to your basket, guarded by 3 defensive players from the opposing team. Game duration 5 minutes. Scoring system 1 point per shot. Scoring system, dribbling the ball more than 3 times per team. stepping on the line, ball out of bounds or loose ball, and misconduct situation, unlimited on ball position, timeouts, 15 seconds on the ball position, starting the game, coin to coin. So, officiating officials, referee, 2. To whistle when a score is made, substitution, timeout, or when a violation is committed and ball position is reversed. Scorer, 1. To record scores of each team. Linesman, 4. To watch line assignment and raise flag once a violation is committed. Timekeeper, to track the time per game and times out. So there are qualities for him to meet the goal of having a satisfying, complaint, free, impartial, and successful game. The following are some of the qualities to be considered. Physical qualities, emotional qualities, mental qualities, and social qualities. Physical qualities. These qualities refers to the physical attributes of an officiating official. Since an officiating official needs to catch up with every detail of what the athletes or players do on court, he needs to have a high level of fitness to be able to perform his job. To determine his level of fitness, he or she has to consider the following. Physical fitness. As has been defined in preceding modules in physical education. Physical fitness is the capacity of an individual to perform his or her daily tasks without undue fatigue and still has extra energy for creations and emergencies. Physical fitness is not achieved overnight. One must work on with elevating his own level of fitness if he or she has to perform better in his chosen field of endeavor. Several ways to determine one's fitness which are basis in improving it include body mass index of PMHR and THR, personal maximal heart rate, and training heart rate of fitness or exercise program, and nutrition and weight management. Emotional qualities. These qualities refers to the emotional readiness of an officiating official to perform his or her role in a game. He or she might have mastered all the roles and possessed a high level of fitness, but if the emotional attributes don't warrant him of her or her to perform the duties and responsibilities of an officiating official, failure is expected. Emotional attributes that an officiating official should possess include confidence. It is having belief in oneself. Confidence can be situation specific, but practicing it through actual game immersions and observations of game officiating activities can help improve it. Mental qualities. Just as physical and emotional qualities are essential, mental characteristics are also equally necessary. Mental tautness is the term used to refer to all of the qualities pertaining to one's mental preparations in officiating a game. To be mentally taut requires one to stay focused, regulate one's performance, ability to handle pressure, awareness and control of thoughts and feelings, and one's command and control of the environment. This can be achieved by having a true knowledge of the rules of the games, alertness, vigilance, which results to timely, decisive, honest, and impartial judgment. Decisiveness results to integrity of the results of the game, leading to a satisfying result and acceptance of success and failure for either competing teams or players. Social qualities. Social qualities refers to the ability to deal with others at any given situation. Complaints are inevitable in a game. It is the ability of an officiating official to settle disputes without sacrificing the integrity of a game and the officiating team. To develop such qualities requires practice, just as the emotional qualities do, surrounding oneself with people who can wise decision, especially in officiating endeavors, might help one improve his or her decision-making skills. Ah, basketball referee hand signals. Jump ball, charging, traveling, technical foul, 3-second violation, point score 1 and 2 finger, personal foul, 3-point shot, blocking. So this is also the basketball hand signal. Substitution, charge timeout, 1 point, 2 points, 3 points attempt, 3 points successful shot, stop block for foul blowing whistle simultaneously, traveling, 3 seconds jump ball. So there are seven benefits that you can get in playing basketball. Burns calories, helps improve cardiovascular, boosts the immune system, develops and improves bone strength, promotes muscles development, benefits mental health, being social. Okay, so any clarifications about our topic this morning? So if none, so thank you so much.